Section 12.4, Procedures and Pharmacology. Diagnostic procedures. Immunoassays use the antibody-antigen reaction to produce a measurable response. Immunodiagnostics use an antigen-antibody reaction as a diagnostic tool. A tool can contain either an antigen or the antibody. A test is positive based on the presence or quantity of the antibody-antigen reaction. The antigen or antibody used in the test can be conjugated with a radiolabel, fluorescent label, or a color-forming enzyme. Enzyme-linked immunosorbent assay, ELISA, uses antibodies conjugated to enzymes linked to color-changing dyes to detect specific antibody and chemicals. Okay. Enzyme-linked immunosorbent assay, ELISA. ELISA uses antibodies conjugated to enzymes linked to color-changing dyes to detect specific antibody and chemicals. ELISA is used to diagnose HIV, West Nile virus, malaria, tuberculosis, and rotavirus in feces, as well as in drug screening. Fluorescent immunoassay tests use fluorescent-labeled antibody to attach to antigen. When exposed to a specific light, the antibody-antigen reaction fluoresces. Can diagnose Lyme disease, strep A, and several autoimmune diseases. Lateral flow immunoassay. An antibody is placed on a membrane. The specimen, example, urine or serum, flows across the membrane. Antigens react with antibodies. An area of the strip contains chemical that changes color when the antibody-antigen reaction flows through it. Used to diagnose strep A in pregnancy. In agglutination tests, a particle such as a latex bead or a bacterium is coupled to the pathogen-specific antigen or antibody, creating a particular complex. If the target antibody or antigen is present in the specimen, example serum, urine, or CSF, it attaches to the particle complex and produces agglutination. High blood levels of IgA are found in multiple myeloma, autoimmune diseases such as rheumatoid arthritis and systemic lupus, erythematosus, and cirrhosis of the liver. Low levels of IgA occur in some types of leukemia and nephrotic syndrome. Diagnostic tests for allergies include nasal smears to check the amount of eosinophils in the nose, skin tests to measure the level of IgE antibodies in response to allergens that are injected under the skin or applied with a small scratch. A reaction appears as a small red area. Blood tests measure IgE antibodies to specific allergens in the blood. A radioallergosorbent test, RAST, uses a radioimmunoassay to detect the specific IgE antibodies, but is now little used. Challenge testing is performed by an allergist who administers a very small amount of allergen orally or by inhalation and monitors its effect. Diagnostic procedures to evaluate enlarged lymph nodes for Reed-Sternberg cells to look for cells. X-rays, computed tomography, CT, and magnetic resonance imaging, MRI scans. Lymphangiogram and bone marrow biopsy. Viral testing. Nucleic acid amplification tests, NAATs, detect a virus's genetic material, can be part of diagnosis for hepatitis, upper respiratory tract infection, COVID-19. Antigen tests detect viral proteins, part of the diagnosis for hepatitis and COVID-19. Swab sample COVID testing. Antibody or serology tests look for antibodies in your blood to determine indicating a viral past infection. Used as part of a diagnosis of hepatitis, HIV, and COVID-19. So bacterium, Greek for a staph, a unicellular microorganism that multiplies by cell division. Bacteria is plural. Complex, Latin for woven together, a stable combination of two or more compounds in the body. Conjugate, ate, composed of pertaining to, conj together, Jew is yoke. To join together, usually in pairs. Fluoresce, Greek for bright color, emit a bright color light when irradiated. They're all just talking in the shop.
No.
It's Gordon's in there.
Yeah.
Yeah. Irradiated with ultraviolet or violet blue rays. Fluorescence, sense, quality of, property of glowing in ultraviolet light. Fluorescent, adjective. Ent meaning forming, produced by fluorescence. Immunoassay, assays to evaluate. Biochemical test that uses the reaction of an antibody to its antigen to measure the amount of a substance in a liquid. Immunodiagnostics. Diagnost is decision. A diagnostic process using antigen-antibody reactions. Okay. Lymphangiogram. Lymphangial meaning lymphatic vessels. Gram is recording. Radiographic images of lymph vessels and nodes following injection of contrast material. Radioallergosorbent. Oh. Radioallergosorbent. Yeah. Okay, radiation, allergo is allergy, and sorb is suck in. Int is the end result. A radioimmunoassay to detect IgE-bound allergens responsible for tissue hypersensitivity. Assays to evaluate. Okay, radioimmunoassay. Immunoassay of a substance that has been radioactively labeled. Serum, Latin for whey, fluid remaining after removal of cells and fibrin clot. Serology, study of the reaction between antigens and antibodies in serum. Therapeutic procedures and drugs for lymphatic and immune systems. Lymphatic therapy, careful observation to chemotherapy, radiation, and bone marrow transplantation are considered based on the rate of growth of cancer cells of Hodgkin and non-Hodgkin's lymphoma. Regional lymphadenectomy removes a several lymph nodes from an area. Radical lymphadenectomy removes all the lymph nodes from an area to detect presence of cancer cells. Compression garments and treatments. And massage are used. Okay, compression garments and treatments and massage are used for lymphedema. There is no cure. Antibiotics treat strep throat and tonsillitis. And recurrent tonsillitis may be treated with a tonsillectomy. Okay, and a splenectomy is most performed for a ruptured spleen and painful splenomegaly. Immunotherapy. Immunotherapy, also called biologic therapy, is designed to boost the body's natural defenses against cancer by using substances either made in the laboratory or made by the body to enhance or restore immune system function. This form of therapy can stop or slow the growth of cancer cells and stop cancer from metastasizing. The two types of immunotherapy include monoclonal antibodies made in the laboratory can attach to cancer cells to flag them so that macrophages in the body's immune system can recognize and destroy them. Two pathways inside cells that cancers use to invade the immune system have been identified and named PD-1 and PDL1 and CTLA4. These pathways can be blocked with antibodies called immune checkpoint inhibitors to allow the body's immune system to respond to the cancer. Immune checkpoint inhibitors, ipilimumab or Yervoy, nivolumab, Opdivo, and pembrolizumab, Keytruda, have been shown to improve overall patient survival in advanced melanoma. Interferons are a nonspecific immunotherapy mostly given at the same time as other cancer treatments such as chemotherapy or radiation therapy. An interferon called interferon alpha, made in a laboratory, is the most common type of interferon used in cancer treatment. Interleukins are also a nonspecific immunotherapy used to treat kidney and skin cancers, including melanoma. Human immunoglobulins are given by injection to confer passive temporary immunity that provides immediate protection lasting several weeks. There are two types: human normal immunoglobulin, HNIG, made from the plasma of about 1,000 unselected donors to provide antibodies against hepatitis A, rubella, measles, and other viruses found in the general population. Hyperimmune specific immunoglobulins are made from selected donors and provide antibodies individually against hepatitis B, varicella, zoster, rabies, tetanus, and cytomegalovirus. Immunosuppressant drugs. Immunosuppressant drugs inhibit or prevent activity in the immune system and are used to prevent the rejection of transplanted organs and tissues, treat autoimmune diseases, and help control long-term allergic asthma. There are four main types of immunosuppressant drugs: glucocorticoids, which suppress cell-mediated immunity and protect through T cells and macrophages, and by stimulating cells to secrete cytokines. Cytostatics, which inhibit cell division. Cytophosphamide, which is cytosan, a nitrogen mustard alkylating agent, is probably the most potent immunosuppressant. Methotrexate, an antimetabolite, interferes with the synthesis of nucleic acids and is used in the treatment of autoimmune diseases. Azathioprine, or Imuran, is the main immunosuppressive cytotoxic substance that is used to control transplant rejection reactions. Antibodies can be used as quick immunosuppressive therapy and are described above in sections on the monoclonal antibodies and immunoglobulins. Calcineurin, a phosphatase that stimulates the growth and differentiation of T cells. Calcineurin inhibitors such as cyclosporin or Sandimmune, tacrolimus, Prograf, and sirolimus, Rapamune, are used in the prevention and treatment of transplant rejection reactions. HIV drugs. Antiretroviral treatment, ART medications, do not cure HIV, instead decrease the amount of HIV in the blood, letting infected people live a longer, healthier life and decrease risk of passing HIV to another person. Medication must be taken daily, else the amount of HIV in the blood will increase. Initial regimens of 3 or more classes of antiviral drugs. Combination medications deliver the combination in one tablet of bictegravir or tenofovir, alafenamide, and emtricitabine or Biktarvy, and dolutegravir, abacavir, and lamivudine, or Triumeq. Influenza drugs, oseltamivir phosphate, Tamiflu, can be used to prevent the flu, to treat the flu within 48 hours of the onset symptoms. Zanamivir, which is for Linza, is orally inhaled white powder that can be taken to prevent influenza infection during a flu outbreak. Okay. Alkylation, introduction of a side chain into a compound. Antimetabolite, a substance that antagonizes another substance. Antiretroviral, drug that fights infection by a virus. Okay. Biologic, pertaining to the study of life in living organisms. Calcineurin, a chemical that stimulates the growth and differentiation of T cells. Compression, a squeezing together to increase density and or decrease a dimension of a structure. Cytokine, a hormone-like protein that regulates the intensity of an immune response. Cytostatic, inhibiting cell division. Cytotoxic, destructive to cells. Immunoglobulin, specific protein antibody generated by an antigen. Immunotherapy, treatment to boost immune system function. Inhibitor, an agent that restrains a chemical action. Interferon, a small protein produced by T cells in response to infection. Interleukin, a group of cytokines synthesized by white blood cells. Monoclonal, clone cutting used for propagation. Mono 1. Derived in the laboratory from a protein from a single colony of cells. Splenectomy, surgical removal of the spleen. Tonsillectomy is surgical removal of the tonsils.